Those are one of the most important problems facing the older population. Falls and all unintentional injuries are the fifth leading cause of death in older people, and falls comprise 2/3 of those unintentional injuries. About one out of 3 older people will fall every year, and about 10% of those will require medical attention. Main risk factors for falls include muscle weakness. That's probably the most important of the risk factors. Then problems with ambulation, unstable gait, balance, and then another big risk factor is just having a prior fall in the last year. And then, of course, some of the things you might imagine are risk factors like vision problems and problems with simply being able to get around, and medications are a big risk factor. Seniors can do a lot to prevent falls. There have been studies that have been done on fall prevention showing that you can easily prevent well over half of falls by doing a certain number of precautionary things. Importantly, periodically you should consider a fall risk assessment. If you go to your doctor for a checkup, make sure that the risks for falls are looked for, such as the ones that we just talked about: weakness, trouble with balance, gait, blood pressure that sometimes drops when you stand, medications that are not well tuned up. So that's one important thing. Probably the other very large important way to prevent falls is to exercise regularly. Having somebody who regularly exercises will have better balance, will usually have more stable walking patterns, and be significantly less likely to fall. And then finally, the third way to prevent falls is to make sure the environment is as safe and senior-friendly as possible. Some of the things you can do is get rid of hazards from on the ground, electrical cords, carpets that have edges that stick up or that might slip out from under you. In the bathroom, it's very important as you get older to make sure there are adequate grab rails in the shower and next to and then as you get even older, you need help getting up off of the toilet. Having grab rails next to the toilet is very important. So lots of environmental things that can be done. Better lighting and accessible entryways, getting rid of unnecessary steps. There are a number of professionals who can do in-home environmental assessments. They include people from home health agencies, visiting nurses, visiting occupational therapists, physical therapists are particularly good at doing that. And there are actually environmental home specialists that can do that. I mean, it's analogous to baby-proofing a house when you bring home a newborn, and you sort of gradually get your house safe for kids. As you get older, you need to do a kind of a reverse baby-proofing of the house for seniors to make it safe environmentally. Well, there are a number of really good senior exercise programs that have been shown to reduce risk of falls. One classic group have been the Tai Chi studies, and Tai Chi is a nice example of a sort of a well-rounded exercise pattern that involves balance training, some core strengthening, some endurance, and as well as stretching, and it's a group usually done in a group that's fun, where you have positive reinforcement from your friends and colleagues. And so that's one group. But many senior centers, in fact, most senior centers offer senior exercise programs. And the important things to include in a senior exercise program are strengthening, core strengthening, as well as arms and leg strengthening, and then some balance training. It can be done by alternating, standing on one foot or the other, and there are balance boards, balance platforms that you can use. And then endurance training, either on a treadmill or a stationary bicycle. Those provide really good exercises. So the most effective of the exercise programs are those that usually happen 3 times a week, 45 minutes to an hour each time. And they're most of the effective ones do involve group activities, so that it makes it kind of a social event as well.